how to help relieve lower back pain. Come to standing for a few moments and focus on the best possible posture. Lifting your arms can help you lengthen the spine a little bit more, lengthening especially the rib cage away from your pelvis. Leave your arms forwards for a moment and feel the broadness and the natural shape of your upper back. Focus on grounding your feet, balancing through your knees, your pelvis, your shoulders and your head, stacking them one above the other, particularly paying attention to the angle, the tilt of your pelvis, so it doesn't rock too far forwards or backwards. Adjust your shoulders and your head to bring them into as close to perfectly aligned as possible. Split the legs one foot in front of the other. This is to stretch out through the groin area. You can lift your arms to help enhance the feeling of stretch sensation through the front of the groin. When these muscles at the front are tight, this can cause the pelvis to tilt forward and the lower back to ache a little bit more. So stretching through the front of the groin, moving down and up, deepening the stretch as you go down perhaps. Make sure you're tucking under with your pelvis as you do this. You don't have to lift your arms, they can stay down beside you. Turn to your other side and repeat. Again, watching that you're tucking under slightly perhaps with the pelvis, especially feeling you're lifting up through the front of the hip bones. When you bend your leg, watch the front knee doesn't push too far forwards over the toes. Adjust that front leg. Do it about 5 times each side, or longer if you wish to. Stand with your feet a bit wider than hip socket width apart. Place your hands on your thighs and scoop up through the tummy muscles and round your back. Spine curls, articulating through the spine, lengthening the front edges of the spine as you arc upwards and stretching and lengthening the back edge of the spine when you curl your head under and tucking under with your tailbone. Lengthening your spine, the front edges and the back edges, gaining some movement back through the body. Stand with your feet hip socket width apart and lift both arms upwards to lengthen the spine. Lower one arm to the side of the hip and gently bend to one side. As you do this, lengthen the spine and support the back by perhaps bracing your abdominal muscles in. Lengthen the arm, so particularly lengthening that side edge of the spine, of your waistline muscles. Reach up and lengthen. Perhaps stay on one side, moving over, back up, over again. Not necessarily deepening, but spending more time moving out and into the stretch. Being aware of the sensations through the whole of the back as you do this. Make sure your lower back isn't overly arcing. Its natural arc, it should be present. So perhaps the sensation might be that you need to stay slightly tucked under with your pelvis if you have the tendency to let the pelvis tip forwards. Use a chair perhaps the next. Sitting on a chair, fold your arms, keep your pelvis and knees still, and gently rotate side to side. Keeping our upper backs as free and mobile as possible can help relieve the pressures on our lower back, your lumbar spine. Take your hands on your thighs and gently curl down as far as feels comfortable for you. Then tuck under with the pelvis and sit tall and go the other way. Creating gentle movements through the spine to see what our functional range is. Can we roll through and arc up? Just regaining some fluidity in our spine. Take hold of one leg and circle the ankle 5 times in each direction. Keeping all of our joints mobile is really important to help our lower back. Circling each ankle 5 times in each direction. Step forwards with one leg. Keep the spine long and slide your hands down and up the leg, tipping forwards. Keep the spine long. This is to stretch out the muscles in the back of your thighs. When these muscles perhaps become too tight, again, they'll help to tip the pelvis in the wrong direction. That may also assist with lower back pain. Lengthening the spine as you tip forwards, Feel the stretch all the way down through to the back of your heel if you flex the toes towards your face. Come to standing. Place one foot on top of a chair, lifting both arms. This is similar to the first thing we did where you bent down and up into a lunge. Lengthening up. So this is one you could do instead of the one that we did at the very beginning. Lengthening upwards. So just to lengthen the spine, perhaps coming into a very mild back bend as you lift your arms. You don't have to use a band for the next one. You could just move both arms without the band, but the band could help support you, or use like a lightweight stick. Move the arms backwards and forwards. This is to help open up the chest muscles there. So as you move your arms backwards, you'll feel a strong stretch sensation perhaps into your chest wall. Circle one arm around and then the other one. Allow your upper back to move slightly as you do this, but keep your pelvis still. Take both hands to the top of the shoulders and circle them both around. Around the spine, lift the chest. Round the spine, lift the chest. Round the spine, lift the chest. Again, creating dynamic movements for your body, freeing tensions as you do these movements. Come to all fours. Hollow the tummy muscles. Lengthen the spine towards the crown of the head. Reach forward with one arm and backwards with the opposite leg without the pelvis tipping. Change sides. Just get a feel for how level and still the pelvis, the shoulders are. And the support comes from the hand that's down on the floor. Take one hand off and then down. Then the other hand and down. Brace your tummy, lengthen the spine. This is a great core exercise that works your back and your abdominal muscles. Then try just the legs. Making sure as you lift the leg, you're not tipping your pelvis forwards. Keep your back as still as possible as you do this. Then add on the opposite arm as you reach one leg back. Opposite arm and leg, perhaps doing about 10 of these. Lengthening the spine, scooping your tummy muscles in, keep the chin tucked in towards the throat. Sit back, rest. Rock forwards and backwards, again regaining movement. Hoping the elasticity of your muscles and helping them return as you move fluidly forwards and backwards. Come onto one side on your forearm and have your legs in a bent position. Lengthen the spine towards the crown of the head. Scoop your tummy muscles in. Use your top hand perhaps to help you get up and down. This is to help strengthen your side stabilizing muscles of your spine. Lift and lower, perhaps 10 times. Lengthen your spine, scoop your tummy muscles in and support the bottom shoulder by relaxing it back and down. Come on to your other side and repeat the same thing. Starting perhaps with your top hand on the floor to assist the getting up and down. And as you feel you're able to, perhaps you lift the top arm up. This could be advanced again if you were to stretch out both legs and have them straight. Make sure your bottom shoulder is supported and you're not sinking into it. Come onto your back. Bend your legs. Get comfortable. Press into your feet. Begin to lift up through the spine. Hold that for about 10 seconds. Adjust your pelvis. If you feel any pressure in your lower back, perhaps lower the hip lift. Come all the way down again. Rise up again. Curl and roll down again. These spinal curl rolls are very good and effective for again regaining that movement and fluidity in your spine, building up tolerances to movement. Keep rolling up and down, again about 10 times. This works your buttock muscles, stretches through the front of the hip and the groin area, works your back muscles. A really good exercise to do every day. This is a modified abdominal curl. Slide one leg away, keep one leg bent. Place the hands slightly underneath your lower back, brace the abdomen, and lift and lower about 5 times, coming up and going down. The hands don't need to be underneath the lower back. You could use them to support your head. Rising up, try to keep the pelvis still. This can be done more advanced with both legs lengthened, and this is to help ensure that the pelvis does remain still. Well done. Bend both legs. Cross your arms across the centre of your chest. Rock your knees in one direction and your head and your shoulders slightly to the other side. Rocking your legs side to side, carefully with control. Hollowing the abdomen in, perhaps drawing up through your pelvic floor. As you lengthen through the spine, carefully rotate knees and pelvis one side and shoulders and head to the other. Come onto your front. Let your legs be about shoulder width apart, perhaps wider. Hands to the side of the head. Lengthen your spine. Carefully lift your head, shoulders back and down, and lengthen as you begin to lift. Not worrying that you're coming up very high, just a shallow lift is good. And begin to increase this range if you feel this feels comfortable for you, but it's not necessary. Lengthening through the spine, reassuring your lumbar spine, your lower back, of its natural curvature. This is a great back strengthener. In Pilates it's called the dart. Use your hands on the floor to support you, or hover them off the floor with the palms turned down to enhance and advance this exercise. Keep your pelvis level. Make sure your pelvis doesn't tip and rock as you do this. Lifting your arms up and down. This helps to engage your upper back muscles and all the muscles running along your spine as you lift and lower your upper body. Come up onto all fours. Rock your spine up and down to release at the end. Well done. Repeat this. Thank you.